Good evening, class. Thanks for having me today. I'm your anchor, Suleiman Usman, on GNS 111. Thanks for listening and thanks for the patience. Last week we discussed practically on procedure taking of vital signs, which we discussed on how to take vital signs, and this vital signs encompasses the following, such as taking of body temperature from the patient, taking of respiration, taking of blood pressure, and taking of pulse. All this encompasses to be taking of vital signs. We have discussed at length on how to take these vital signs, but the temperature by starting with body temperature, bringing out your thermometer, removing it out, looking at the previous measurement of the thermometer or previous uses of the thermometer. When it's above 35.5 degrees, 35 degrees centigrade, which is above normal, you wipe it down with a wet swab and clean with dry swab before you put it at the pit of the armpit. Then you close the arm of the armpit. When you close the armpit of the patient, you gradually move the hand of the patient by bending it, the elbow and the lower arm, crossing the abdominal wall of the patient. From there, as the counting system, at the counting minutes or seconds of body temperature starts, you keep taking pulse of the patient in the count of 1 minute. After taking the pulse of the patient in the count of 1 minute, you keep noting. The next you take is the respiration of the patient. In the same position of counting pulse, you count the respiration of the patient by noticing the movement of the thoracic cavity up and down. Then you start the counting of respiration. This equally take 1 minute. After counting of respiration, then you come back to take the blood pressure. The blood pressure now, you expose the sphygmomanometer by bringing out the cuff and tie the cuff above the elbow, which is the upper arm. Then after tying the cuff above the upper arm, you put the stethoscope, the diaphragm of the stethoscope, below the cuff of the sphygmomanometer, and put the earpiece of the stethoscope in your two ears. Then you start inflating the balloon of the swig. As you keep increasing the balloon of the swig, then you see the mercury rising. In the course of its rising, you start hearing sound like dub, 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 dub. You keep noticing that sound. At the point at which the sound stops, that is the point at which the taking of vital signs will start by deflating the balloon gradually. You have to go gradually if you want to get good results. You have to go gradually. As you are coming down gradually, the first sound you hear from the coming down of the mercury, dub. That dub, you note the sound and the level at which it has taken place. That level is known as the level of systolic. If the level is 120, at the point of 120, you notice that systolic of that patient is 120. Then you keep coming down, deflating gradually. As you are deflating gradually, the sound keep coming down, dub, dub, dub. As it's coming down gradually, you see the pressure or the volume of the sound will keep reducing gradually. As it's reducing gradually, at the point at which the sound is no longer visible or you can no longer hear the sound, you take note of that aspect or that point. That point is 70 or 80. You note that. Then the diastolic of that patient is 70 or 80. Then with this, you now remove the cuff from the patient. You remove your stethoscope from your ear and remove the diaphragm from the arm of the patient. Remove the cuff, deflate the air. After deflating the air of the balloon of the sphygmomanometer, you now fold it and put it back to the jar. The jar now will be closed and be maintained. Then with this, You now need to record: 1, the temperature taken; 2, the respiration taken; 3, the pulse taken; then 3, the blood pressure taken. We have noted that the blood pressure, if it's being read at the point of 120, the systolic is now 120, while the last point at which you hear the sound is 70 or 80. Then the reading will be 120 all over 80 or 70 of what? Millimeter of mercury. Then you document all the respiration, pulse, respiration, blood pressure in a vital signs chart of the patient folder. Hence, you have documented this. Then you wash your hand. Remember, before you carry out any procedure, you have to wash your hand before, then you wash your hand after. Why? You need to wash your hand before so that you, as a nurse, will not contaminate or infect patient by patient going home with nosocomial infection. 2, but you washing your hand after procedure so that you don't get infected too through patient. So we have to take double weight traffic prevention in that course. Now you make sure you empty all the used content you have used. Then you prepare all the equipment you have used and return them back safely for next use. That's the procedure of what we have taken so far. That's the summary of what we have done in summary. Then in the procedure now, we now separated, since the classification of vital signs are based into 4. We now see that even in taking of vital signs, in taking of temperature, taking of temperature are principally divided, can be taken in 3 places. 1, taking of temperature per oral. 2, taking of temperature per axillary. 3, taking of temperature per rectum. Now we have seen how to take temperature per axillary. In you taking temperature per axillary, the point of your thermometer, after it has been wiped, being read, now put at the pit of your armpit. Don't just drop it across. If you drop it across, atmospheric air will be penetrating through that area and you don't get good result. But when you want to put your thermometer, make sure you open the patient arm upward. When you open the patient arm upward, you put the tip of your thermometer, which is the mercury side, at the pit of the armpit. Then you close down by bringing down the arm gradually. Then bringing down the arm gradually, we now close the possible penetration of air from the armpit, from atmospheric air to the armpit. Then you now cross the lower arm of the patient towards the chest of the patient, where you are going to take pulse the respiration. With that, you'll be able to take axillary temperature. But now, practically, let us look at taking of temperature per oral. Taking of temperature per oral. If you are asked to go and take temperature per oral, what are the precautions you need to take? What is the procedure? Now, in you taking out procedure, let us ensure, in case you are asked to take out any procedure, 1, first, you define what that procedure is. Like you are asked to come and take out oral procedure, you define what oral procedure is. If you are asked to come and take out vital sign procedure, you define what vital signs procedure is, what it entails to carry out vital sign procedure. Like I've mentioned before, you mentioned the cardinal area, which is the pulse, respiration, temperature, and blood pressure. Those are the cardinals of taking vital signs. But now we are now coming to take procedure in the procedure involved in oral temperature. You have to define what is oral temperature, taking of body heat measurement through the oral cavity. That is the oral, taking of oral temperature. Then you now tell us what are your items you require in taking out that temperature sequentially. What are the things you require in taking out that oral temperature? Then after telling us the requirement of taking out oral temperature, you now come down to come and explain the procedure itself in taking in doing oral temperature. We now explain that number 1, explain the procedure to the patient and take consent from the patient. Explain the procedure to the patient and take consent from the patient. Not that you after you set your proli, I mean you set your tray. That's when you now take your tray to the patient bedside and go and explain to you, sorry, Hajia or Alaji, I want to take your vital signs or temperature. No, it's wrong. You have to go and seek the consent of the patient. Please, I'm coming to take your body vital signs or coming to take your body temperature before you go and now set your procedure out. Then number 2, he said, after arranging or assemble all the requirements, you see, bring the assembled articles to the patient bedside. Bring the assembled article to the patient bedside. After bringing to the patient bedside, he said, put the patient in a comfortable position. In case it's not lying well, maybe you ask the patient to lie on his back or on the side. It depends on the appropriate area that is comfortable for the patient and the kind of condition the patient is facing at that time. You now place the patient on a comfortable position. Number 4, he said, perform hand washing. I've said it earlier. Any procedure you want to do hand washing first and do hand washing last. So this one is saying, perform your hand washing before you carry out any procedure. Then you put on your gloves. Put on your gloves. In any procedure you want to carry out, please ensure to put on your sterile glove or disposable glove, as the case may be. Because you know that taking of vital signs is not a sterile procedure, it's a clean procedure. You can use a disposable glove. Number 5, he said remove thermometer from its container. You have to remove the thermometer from the container where it's being lodged. You have to remove it from the container. Then twisting in the motion form by twisting this way. Why do you twist it this way? You have to twist it that way because it might be previously used. But the temperature at that time that was read was not brought down before it's been lodged in its container. Or and it's being kept in a room and maybe the room is hot or the environment is hot, then the thermometer itself will be reading itself because of the environment. So to rule out wrong information or wrong recording of patient diagnosis, you have to remove the thermometer from the container, then you twist it in a motion. Then you after twisting it, bringing it to the level of bringing it to the level of 35 degrees centigrade. If you bring it to that level, make sure you wipe the thermometer from your fingertip down to the mercury bulb. You wipe it from fingertip that you used to wipe, then down to the mercury bulb. After wiping there, you ask the patient to open his mouth. You now ask the patient to open his mouth. The patient thereby open his mouth. You lift the tongue up while the bulb. So the bulb must be inserted sublingual. And the thermometer is placed underneath the patient tongue, that is sublingual pocket, at the lower jaw. After insertion of that thermometer at sublingual aspect of the mouth, then he said, instruct patient to close his lips and not breathe around the thermometer, but breathe through the nose. Because when the patient closes his mouth and you allow the patient to be opening his mouth to breathe, the atmospheric air coming in will be cooling down the effect of thermometer, so you don't get good results. When you put the thermometer inside and sublingual to the patient tongue, you make sure that the patient closes his lips together and not breathing through the mouth but through the nose to prevent atmospheric air interfering with the procedure you are taking. Instruct the patient to close his lips and not to breathe through the mouth. Then after doing that, they say leave the thermometer in place. You leave the thermometer in place in the oral cavity for about 2 to 3 minutes. Then after that, after timing, and I told you the kind of time you use as a nurse, you use your breast watch or you use your wristwatch. In the case of you using your breast watch or wristwatch, ensure that as a nurse you have a wristwatch that has a second hand. The moment of that second hand is what you are going to look at the process of you inserting. You count the second hand as it's moving from the point to another point at that same point is a minute. Then you start counting it. Then after reading for that period of 2 to 3 minutes, then carefully remove the thermometer. Carefully remove the thermometer. Wipe it dry and swab from the finger top to the bulb. You wipe it dry. After wiping it dry, you dry the area. You dry the thermometer. After using it, you remove it out. Then you wipe it with dry swab so that you can enable you to read the thermometer. And after reading the thermometer, you have gotten the correct figure, maybe 36.6 or 36.5, 37, and so on. After reading it, then you now wipe it down with swab, wet swab. After wiping it down with wet swab, you now dry it again with wet swab. After drying it with wet swab, you now put it back in its container. As you put it back in its container, record the reading. You record the reading in the vital sign chart. After recording the reading in the vital sign chart, you make sure that you leave the patient in a very much comfortable position back again. After leaving the patient in a very comfortable position, then ensure you report any abnormality you might have found. In the case of you taking temperature, make sure you don't express your feelings to create an anxiety or panicking to the patient. Maybe the temperature is high, you suddenly frown your eye towards that you're reading. It will send signal to the patient that something must be wrong somewhere for that nurse to have frowned his or her eye towards the reading of that thermometer, of that taking of temperature. So you don't frown. You only report your readings of abnormality in your vital signs chart of the patient. Then after doing that, make sure you perform your hand hygiene again. But before performing your hand hygiene, make sure you discard all the used swab and everything. After discarding that, after washing that, then you discard all the used swab and abnormality. Then you return all those used items into its container, and that procedure is done. Thank you for giving me the opportunity. I'll be glad to meet you again next week. Let us do it again. Please keep reading and keep asking questions when you are confused, and so that we'll keep giving explanation to that. May God bless you all as you remain in the classroom. Thank you.